Hello, everyone. This is Amy Hagel, SHINE Liaison at Senior Connection Center. And this is Medicare Mondays. Today, we had Fran Auvergne, SHINE Medicare Counselor from Hillsborough County. And today, she's going to be discussing a few questions regarding Part D. Well, hello, Fran.
Hi, Amy. How are you?
I'm good. So one of the questions that we get quite often from our clients is, when can they enroll in a Part D plan?
Well, that's a good question. The best time to enroll is during your initial enrollment period, and that's 3 months before your 65th birthday, the month of your birthday, and then 3 months after your birthday. If you miss that, you do have another chance to enroll at the general enrollment period for Part A and Part B, and that is from January through March. Now, once you enroll in Part A and Part B, then you can sign up for Part D from April 2nd to June 30th of that same year. Now, there are other periods that are called special enrollment periods, and there are several different occasions that you might be eligible for a special enrollment. It could be if you're terminating your healthcare coverage, drug coverage from an employer, or if you move out of the service area of the drug plan that you are currently in. So you would need to call a SHINE counselor to be sure that you get assistance for signing up for those Part D plans whenever one of those situations, a life change situation, occurs.
Excellent. And and when can somebody can change their Part D coverage?
Well, actually, right now is a great time to do that because we are in open enrollment, which begins on October 15th and runs through December 7th of each year. When you enroll at that time, it becomes effective on January 1st of the following year, so that you want to be sure that you always check that information, because companies can change the formularies that they are going to use for current drugs that you may be on. They may change prices. And so open enrollment is a really great time to do a Medicare check on the plan that you have, to be sure that you're getting the best value and the best coverage. Also, every year your medications and your health may change, so that this also gives you another period to do a healthcare checkup.
Excellent. And what if somebody doesn't take any prescriptions? Does it make sense for them to get a Part D?
Well, I would say woohoo for you, because that's really good. But as we age, eventually you're going to have to take some prescriptions. And if you do not enroll in Part D when you're first eligible, you may end up paying a penalty, and or have a gap in coverage. And that would not be great for you. And the penalty is in force through the rest of your life. That's a long time. So you definitely want to always sign up. And there are plans that are inexpensive that you could certainly get should that happen.
Good. Good to know. And is there anything else regarding Part D that clients should be aware of?
Well, a basic problem or issue is that pharmacy and prescription drug fraud is a trend in Medicare. Due to the fact that prescription drugs are expensive, and pharmacy scams make people lots of money, criminals continue to exploit the Medicare Part D program. There are many types of schemes um, that they use. Pharmacy fraud primarily occurs when Medicare is billed for medication that it did not get to the beneficiary. For example, let's say that the pharmacy fills a prescription that you're no longer taking and you don't ever pick it up, and then they put it back on the shelf. Well, unless they go back into their system to cancel that, Medicare will pay for that drug. And so that certainly is one way that is a scheme that works for criminals. Sometimes also a pharmacy can distribute less of the medication than you're supposed to get. If you're supposed to get 90 pills, you may only get 78 or another number. And normally we don't count them. It's just as we get close to the end, we say, uh-oh, how come I don't have enough? So then several months has already gone by. Or the pharmacy can provide and bill for an expensive compound medication when they're giving a traditional or less expensive drug. Sometimes that happens with topical pain creams. That seems to be an applicable part of the scam there. There are times when it's a mistake. But then there are other times that it is intentional. It is when it is intentional that it is fraud. And you can always contact SHINE and to report Medicare fraud and abuse. And just as a side note, the only way that Medicare can tell if there's been a problem is that you check your explanation of benefits or your Medicare summary notice to make sure that what Medicare has paid for is the service you really got.
Excellent advice. Well, thank you for joining us today, Fran. And as she indicated, yeah, give us, if you have any questions related to anything related to Medicare, Part D, or fraud and abuse, please give us a call at 1-800-963-5337. We're open Monday through Friday from 8 a.m. until 5 p.m. Well, thank you for joining us again.